Yeah, so this is a very important abstract. As you know, the only prospective randomized study in T-cell lymphoma, in nodal T-cell lymphomas, is the ECHELON-2. ECHELON-2 looked at combining Brentuximab with the standard of care chemotherapy, CHOP without the vincristine, so it's CHP-BV, and was compared to the standard of care, which is CHOP, in nodal T-cell lymphomas. The study was set forth in such a way that CD30 expressing tumors were allowed to be enrolled in the study, but the requirement by EMA in Europe allowed only about 30% of the non-ALCL tumors, because ALCL is anaplastic large cell lymphoma have a uniform and 100% expression of CD30. So obviously those patients were enriched in this study. About 30% are non-ALCLs, and the data has been reported at several instances. We had an oral presentation in 2019, a publication in Lancet, and also Annals of Oncology. What we show here is a 7-year follow-up as we see through the lens of a PET scan. So we've never reported the PET scan data from this ECHELON-2, 452 patients and about 250 each in both the arms. And what we show is how the PET is able to prognosticate the long-term responses. And if you look at the way the PET was done, the baseline PET scan was done to assess the disease, and PET scan was done after 4 cycles to look at the interim response and the PET at the end of the treatment. So this PET4 is the interim response. We use PET4 as to pivot how the patients would respond. So when you look at the data, and when the PET analysis was done, patients achieved a score of 3 or less on the PET scan, the dual score. These are the patients who did very well. And the PET4 negativity, so that is 3 or less, these patients had a very long-term response that you see in the 7-year curve. The PET positive patients obviously relapsed earlier and didn't do as well. Interestingly, we saw a similar response in both A plus CHP or CHP plus BV and the CHOP. Even those patients achieved a PET response in CHOP were able to maintain the response for a long period of time, although the numbers are lower than CHP plus BV. That goes to show that Brentuximab is essential for patients with this kinds of lymphomas that express CD30. So PET also gives us another reason to look at this data, not just from a long term. It's also very easily translatable in clinical practice. We order PET scans. Sometimes PET scans don't get approved. So I think it's important for the insurance companies to know that PET is very important for us to guide the treatment plan, right? So it's going to inform the decisions. If you don't do the PET scan, then you won't know the patient's going to do well or not. If you do a CAT scan, you won't have the same kind of information. So it's both a long-term read and also a very practical value to the practicing physicians.